Hey, Dr. Shawn Nabors here, licensed mental health therapist, West Michigan anxiety specialist, and owner of the Anxiety Treatment Center of West Michigan. Hey, I would like to talk to you today about this really cool Iron Man mouse. I love everything Iron Man. I actually stole this from my kids, but actually this is not what I want to talk to you about today. I'm just really excited about having it in my office. I would like to talk to you today, in all seriousness, about how do I address my anxiety issue, or how do I treat my anxiety? I'm talking to people who have dealt with anxiety for multiple years, and it's moderate to severe anxiety, and it's really impairing their functioning. The first thing that you need to do is first commit to treatment. In a study I published this year, I won't tell you the title because it's very long. This study also highlighted, or explored, I should say, how long it takes people to get into treatment for anxiety compared to depression. So it takes people on average 5 to 10 years longer to get into treatment for anxiety than for depression, and that is the result of cultural stigma that surrounds anxiety. So try as best as you can not to let that cultural stigma affect you and get into treatment. Next, you want to take a symptom-based approach to treating your anxiety and move towards developing skills for your anxiety and managing it and responding to it. So what does a symptom-based approach look like? Well, it looks like a medication approach. A lot of people are against medication, but if you have a debilitating anxiety issue, the thing that you need most in that moment is to take the edge off so that you can begin to restore functioning. So that would look like first going to see your family practice doctor or psychiatrist and talking to them about your anxiety and your plan for addressing your anxiety, to start by taking the edge off the symptoms and moving towards working with a therapist, preferably a specialist, to develop skills for it later on, and then getting off of that medication. So talk to a medical doctor about your anxiety. Talk about getting on possibly the lowest dose of anxiety medication and seeing how that works. And then after you get the medication part figured out, you want to then move to start finding a therapist to work with, and not just any therapist. I love and respect therapists, but we're not all the same. You want to work with a therapist who specializes in anxiety and can show that they specialize in anxiety, and you should interview them about that, their treatment history with anxiety, their treatment success with anxiety. Typically therapists who use an evidence-based approach, such as CBT. There's a lot of other evidence-based therapies, but that's the one that typically is the gold standard. Those therapists sometimes specialize in anxiety. I hate to say this, but you're going to have to do your research in finding a therapist who specializes in anxiety. Once you find that therapist, start working with that therapist to develop skills for your anxiety, and eventually moving into what is called exposure therapy, where you can practice those skills in the situations that trigger you. Now, eventually the goal is that while you're working with that therapist, especially when you get to the exposure parts of therapy, you're now cutting back off of your medication, because it is not a solution for your anxiety. It is a short-term problem solver for the intensity of the symptoms. So once you start to develop skills and use those skills in exposure therapy, you cut back on the medication, and eventually you replace the medication with the skills that you have developed working with that therapist. So to repeat, get committed for treatment. Don't let the stigma stop you from getting treatment. Start with a symptom-based treatment first, move to developing skills for the anxiety, and eventually replace the medication with the skills. Hey, thank you for stopping by as always, and take care.